Welcome everyone. Before we dive in, please take a moment to subscribe to our channel. Your support fuels our commitment to creating valuable content for you. Today we're exploring a critical topic, hyperkalemia, a condition characterized by high levels of potassium in the blood. This can often be linked to decreased kidney function. For those experiencing this, a low potassium diet can be a lifeline. Now that we've set the stage, let's delve into how to reduce potassium in your diet. Hyperkalemia, a condition characterized by high levels of potassium in the blood, often affects those who have lost more than 2/3 of their kidney function. This condition can be a bit tricky to understand, so let's simplify it a bit. The potassium in your body is usually balanced by two things: the potassium you consume from food and the potassium your body gets rid of through urine. However, this balance can be disrupted when the kidneys aren't functioning properly. You see, the kidneys play a key role in regulating the body's potassium levels by excreting excess potassium through urine. Now, when a person loses more than 2/3 of their kidney function, the kidneys aren't able to get rid of enough potassium. This can cause the potassium levels in the blood to rise, leading to hyperkalemia. The prefix hyper means high, cal stands for potassium, and emia refers to something in the blood. So hyperkalemia literally translates to high potassium in the blood. While it might sound daunting, there are ways to manage and even prevent hyperkalemia. One of the most effective ways is by eating a lower potassium diet. This means consuming foods that are low in potassium to help maintain a healthy balance in the body. This doesn't mean you have to completely eliminate potassium from your diet. Potassium is still an essential nutrient that the body needs to function properly. But for those with compromised kidney function, it's important to keep an eye on your intake. To put it simply, eating a lower potassium diet can help reduce the risk of developing hyperkalemia and is a crucial part of managing kidney health. It's all about balance and ensuring your body gets what it needs without overloading it with too much of a good thing. As you can see, managing your potassium levels is a crucial part of managing kidney health, but just how much potassium is safe? While potassium is a necessary nutrient, too much of it can be harmful, especially for those with decreased kidney function. So, how much potassium do you actually need? Well, under normal circumstances, experts recommend a daily intake of at least 4,700 milligrams of potassium. However, for individuals with moderate to severe chronic kidney disease, a condition where the kidney function drops below 45 milliliters per minute, the dietary intake of potassium should be less than 3,000 milligrams per day. Now, for those with further restrictions, based on lab results and clinician advice, a low potassium diet would mean consuming between 2,000 to 3,000 milligrams per day. Sounds tricky, right? Well, that's where a registered dietitian or nutritionist comes into play. They can help tailor a low potassium meal plan suited to your height, weight, and dietary needs. Such a plan might include 1 to 3 servings of lower potassium fruit, 2 to 3 servings of lower potassium vegetables, and 1 to 2 servings of lower potassium dairy and calcium-rich foods per day. Add to that 3 to 7 servings of lower potassium meat alternatives, and 4 to 7 servings of lower potassium grains. A tailored meal plan can help you manage your potassium levels effectively. But what are some practical ways to cut down on potassium? Cutting down on potassium doesn't have to be a chore. With a few simple strategies, you can manage your potassium levels effectively. Let's dive right into some practical tips for reducing your potassium intake. First off, become a savvy label reader. Almost all foods contain some potassium, so the key is to choose foods with a lower potassium level whenever possible. The nutritional information on the packaging is your best friend here. Next, portion sizes are crucial. When calculating the amount of potassium in a food, remember that a large serving of a lower potassium food may contain more potassium than a small serving of a high potassium food. Online or smartphone calculators for potassium can be handy tools for keeping track. Another tip is to drain and rinse canned vegetables, fruits, and meats before serving. This simple step can help to reduce the potassium content. Now let's talk about the foods you should be mindful of. Foods that have the highest concentrations of potassium include cantaloupe, watermelons, grapefruit, all dried fruit and fruit juices, avocados, tomatoes, potatoes, both plain and sweet, Brussels sprouts, milk, yogurt, lentils, and most nuts, except peanuts. Yes, these are healthy foods, but if your kidneys can't handle the potassium, they are not healthy for you. But don't worry, you don't have to completely avoid vegetables. There's a process called leaching, which can help to reduce the amount of potassium in some vegetables. Leaching involves soaking raw vegetables in water for at least 2 hours before cooking, which helps to draw out some of the potassium. Finally, remember that foods with a low level of potassium, less than 200 milligrams per serving on average, can be eaten regularly. But watch your portion size. Potassium can quickly add up if you eat large portions. Managing your potassium levels is a crucial aspect of managing your kidney health. By implementing these strategies, you can take an active role in your health journey. As we've discussed today, managing your potassium levels is a crucial part of managing kidney health, especially for those with decreased kidney function. We've delved into the understanding of hyperkalemia and its intimate connection to kidney function, shedding light on why maintaining a balance is so essential. We've also discussed how to determine the right amount of potassium for your body, bearing in mind that this varies based on your specific circumstances and should always be guided by professional advice. Moreover, we've shared practical tips on how to cut down on potassium in your diet. From reading food labels to being mindful of serving sizes, from draining and rinsing canned food to choosing lower potassium alternatives, every little shift can make a significant difference. Thank you for joining us today. Don't forget to subscribe and share this video with anyone who may find it useful. Remember, every step you take towards managing your potassium levels is a step towards better kidney health. Stay strong and stay healthy.